I'm a psychologist that often works with patients with anxiety, and I see them deal with their anxiety in many, many different ways, some more useful than others. So today I'm going to talk about 7 strategies that do reduce anxiety, at least in the short term, but they're not ones I would recommend for you, especially if your goal is to reduce anxiety for the long term. So let's get into it. The first strategy that is helpful for anxiety, but I wouldn't really recommend it in the long run, or really at all, is the use of alcohol or other substances. Now, alcohol really does work by activating certain neurotransmitters like GABA in order to create that sense of calmness and that relaxation. And it also helps us to kind of feel less socially inhibited in social situations, which is why sometimes people like to pregame or take a couple shots before they interact with people because it acts as a bit of a social lubricant. So alcohol can kind of reduce all that activity in our prefrontal cortex that's telling us, we're not doing something right or we're boring the other person. It kind of allows us to feel more and more relaxed, especially like in social situations. But the problem with alcohol, of course, is that number one, it's not super healthy for you. And number two, if you're constantly using alcohol, for example, as a crutch, then it feels like I can't really be able to interact with other people without the use of alcohol, without the use of this particular crutch. And I may need to drink more and more because I'm building more tolerance, or on the opposite side, I might end up drinking too much and end up making a fool or embarrassment of myself, and that's going to be not super helpful from a social anxiety front. So my general recommendation is that we shouldn't be using alcohol as a way to be able to get into anxious situations, but rather be able to develop the tolerance and resilience ourselves to be able to navigate these situations and know that we are the person doing it and not some sort of crutch or substance. So a second strategy that can be helpful for anxiety, but that I wouldn't really recommend, is the use of disassociation, where you might have had that experience where it doesn't really feel like you're in your own body anymore, you've kind of mentally checked out, whether intentionally or not, and oftentimes what people see is that disassociation is almost like a trauma response, where maybe in the past you didn't really feel very safe, you were often in a dangerous situation, but you couldn't get out of it, at least physically, so mentally you decided to either bottle up your feelings or check out because it was just really hard to be in that moment. The problem with disassociation, however, is that as it dampens negative emotions, it also kind of dampens our positive emotions, our ability to engage and be productive in our lives, because if we're kind of hidden in our own internal world, it's hard to express ourselves in the moment and problem solve and do the things needed to be able to engage both with the good stuff and the bad stuff and solve the problems associated with the bad stuff. So a third strategy I certainly wouldn't recommend is the use of self-harm behaviors. And oftentimes people use self-harm as a way of punishing themselves or be able to cover almost that emotional pain with a more physical outlet. And certainly it's not something that I would recommend because it causes both physical damage and could lead to really serious health risks like, well, for example, death. And of course, it's not a long-term solution because it never gives us a chance to be able to break out of this cycle to be able to experience more long-term improvements in managing anxiety and managing distress. So a fourth strategy that I wouldn't recommend is complete avoidance, where complete avoidance basically means that if you never kind of deal with the thing that scares you, the phobic stimulus, so to speak, then we can never feel that sort of anxiety. If we're always kind of skipping that flight, skipping that presentation, or never spending time with dogs or running away from a dog when we see one, if we have a dog phobia, then of course, it's going to reduce that anxiety again in the short term. But avoidance comes with several costs. Number one is that it might actually negatively affect your life. If we're never, going on planes, then we might not be able to travel to the places that we would really love to visit. Or if we are always skipping presentations, we might not do very well in school or would not get that promotion at work. So in that way, it can actually negatively impair the quality of our lives. And then also number two, it might actually, in some ways, maintain that anxiety over a long period of time because our brain never gets to learn that this situation isn't as dangerous as I thought, that I can actually handle this and be able to reduce the anxiety in the long run. And unsurprisingly, one of the most common treatments of anxiety disorders is the use of exposures, gradually building our tolerance to the thing that we're scared of, in again, that measured, gradual way to be able to feel more and more comfortable with something that our brain initially thought was very dangerous. And kind of related to avoidance, another strategy that people engage in that I wouldn't recommend is the use of reassurance. So people who are anxious might always be asking their partner or their friend, am I doing something wrong? Am I sick? They might go to the doctors to constantly get checkups if they have health anxiety, or search online to make sure that, they are fine and nothing's kind of going on. Or someone with OCD, obsessive compulsive disorder, might check their locks multiple times or make sure that something is cleaned multiple times before they feel just right, feel like okay, like like maybe there's nothing going on. And the problem with reassurance seeking is that life is inherently uncertain. There's so much uncertainty in our day-to-day that if we're constantly looking for ways to reduce that anxiety in the short term by getting reassurance, by increasing certainty, then we're not really able to really kind of enjoy life for what it is. And that reassurance seeking is only going to be helpful in the short term. We're going to ask, feel better, then we have to ask again and then feel better. And it becomes this never ending cycle of looking for more and more reassurance. And then number 6 are safety behaviors. And these are the things that I might call just in case things, like things that we do or prepare for kind of excessively in advance to make sure that, the negative thing never happens. Like for example, if I'm going to a party, my safety behavior might be always bringing my best friend so that I know that even if I'm in an awkward situation, I always have that person to count on. Or, if I have worries about sleeping, I'm always going to bring that specific one meditation tape that otherwise I won't be able to sleep with. And although it's totally fine to have certain tools or tricks or little things that we enjoy and would like to have, when it becomes a need to have, a crutch in our lives, then that's when things become a little bit more tricky. And we want to think a bit about what sort of function is this behavior, the safety behavior, serving us, and is it actually getting in the way of us being able to kind of autonomously and independently move through life. And the 7th and final strategy I wouldn't recommend is worrying. So people often worry for hours and days and weeks. For some people, they think, if I just kind of worry enough about it, like something will come up, like I'll be able to figure out the problem. Or for other people, it just feels really hard to control. But regardless, the idea behind worrying is that it's inherently very repetitive and it doesn't really lead to problem solving. So if for you, like you're actually planning and you're problem solving and you got a few things done and it's all very productive, that's fantastic. But if you notice that you're just constantly worrying, then in that particular case, it might be more helpful to break out of that cycle using some sort of strategy to be able to actually be able to live in the present instead of constantly living in the future and wondering what could happen. And if you're interested in learning about some strategies that actually help with anxiety in the long run, I have lots of videos on this channel that you can take a look at. So hopefully this video was interesting for you, and I'll see you in the next one. Bye-bye.